At Munson Healthcare, we're following the advice of the Centers for Disease Control, we're following the governor's executive orders, and we're following the advice of our own infectious disease specialists when we are deciding how we're screening people who are entering our buildings. Right now, with the stage that we're at in the pandemic, we're screening people by asking questions about your health. And if you are showing signs of illness or you answer questions that make you at a higher risk for illness, we're taking some additional steps for you. If you answer the questions in a way that puts you at a very low risk for having COVID-19, then we're not doing additional testing at this time. And that's the right thing to do right now, based on the advice that we have from the people who are specialists in this illness. As this pandemic changes, that may change as well. But for now, as someone who works in a Munson healthcare facility every day, I'm confident that the measures that we're taking are keeping us safe. If you contact your healthcare provider and you're worried that you should be tested for COVID-19, you should know that in order to be tested, you have to have an order from a doctor, a nurse practitioner, or a physician's assistant. The healthcare providers who are ordering these tests are following guidelines that are set out by the state health departments about who should be tested at this point in the pandemic and who shouldn't. If you get tested, you'll be asked to stay home until we get the results of your test. And that's because if you do end up having COVID-19, we don't want you to spread this illness to anyone else. Now, if you do test positive for COVID-19, it's important that you know that a lot of people who get this illness have it like the flu, which means you would stay at home, you'd have a fever and be tired, and you wouldn't feel very well. But you may not need to be in the hospital. In fact, most people who have COVID-19 don't need to be in the hospital. The reasons you need to be in the hospital are hospital-specific treatments like IV fluids or oxygen or ventilator support. And the way you would know if you needed those things is that your healthcare provider would send you in for evaluation. So whether you're early in the process and worried whether you need to be tested or not, or whether you've already been tested, please contact your healthcare provider if you have any questions.